otitis externa. And rheumatoid arthritis or methotrexate with a skin lesion is what we've been seeing today, squamous cell cancer. Okay, so Nida, this time we're going to go for a melanoma, right? So I think for the melanoma, that is going to be the picture right there that they send in. Okay, so have a look at that picture. You'll be describing this picture, right? So.
Yeah.
And a 3 and a 2.
Begin. Enter the room.
Hello.
Hi, doctor.
Hi, my name's Dr. Radwan Ali, and I'm one of the doctors here in the GP. You must be Samantha Brown, is that right?
Yeah, doctor.
Okay, can I just confirm your age, please?
Yeah, it's 60 years.
Okay, and what can I call you today?
Month is fine.
Okay, very nice to meet you, Samantha. I can see that you've had a bit of a concern with a skin lesion today, is that right?
Yeah, doctor.
Okay, can you just walk me through the lesion? Where is the lesion exactly?
Doctor, it's actually on my shoulder.
Mm-hmm.
It's quite some time now. I have it for 10 years.
Okay, you've had it for 10 years.
Yeah. I was fine with it, but recently I have seen that it's increasing in size and I just Googled it and it says like it could be something very bad.
Right. Okay. So obviously you're quite concerned about the lesion today, isn't it?
Yeah.
Okay. So you mentioned that it's getting bigger, and so it was normal for the most part, no symptoms in the last 10 years. Is that what you're saying? Yeah.
No, not really.
All right. And how many lesions are there? Do you have any other lesions?
Uh, no, it's just one.
Okay. And is the lesion growing under the skin or above the skin?
I would say above the skin, yeah.
Above the skin. Okay. And can you tell me a bit about the color of the lesion? Is it the same as your skin?
No, doctor, it's quite
Hmm.
dark. You can see like different
Dark.
colors, brown, red. It's a mix of.
So it's got different shades as well. Okay. And can you tell me about the margins? Are they regular?
No, doctor, they're irregular, yeah.
They're irregular. Okay. You mentioned it's getting bigger. Would you be able to estimate how much it used to be and how much bigger it's gotten?
Doctor, it was just a pea size. And
Hmm.
now I've noticed like 2 centimeters.
Right. So around 2 Ps now,
Yeah,
or
now 2 Ps, yeah, you can say that.
hmm.
But it has doubled, yeah,
Yeah.
definitely.
Okay. Thank you so much. That's very helpful to know. It helps me understand things better. Any symptoms such as I think you mentioned bleeding, isn't it?
No, no, I didn't mention, but yes, when I touch it, it do bleed. Yeah.
Right. Okay. Sorry about that. And any other symptoms such as a change in sensation?
Not really, but doctor, it's quite yeah, it have a tingly sensation
A
sometimes.
tingling sensation. Okay. All right. And any oozing, discharge?
No, doctor, no.
Okay. And how's the skin surrounding the lesion? Has it changed in any way?
No, it's fine. Just the lesion.
And nothing like redness or pain on the
Uh,
lesion or around the lesion?
Not around the lesion, but doctor, the lesion is sometimes itchy as well.
Okay. It's itchy
Itchy.
as well. Right. Okay. Um, does it crust after the bleeding?
No, doctor.
Okay. All right. Just a few more questions to help me understand everything. Have you had any fever?
No, doctor.
Okay. Any other symptoms, like lightheadedness, dizziness?
No, doctor.
Nothing like that. Okay. Have you by any chance spent a lot of time in the sun in the past?
Actually, I do spend still. I love gardening, doctor, and
Okay.
yeah, in summers, I'm in the garden all the time. That's what my husband says. Yeah.
Okay. That's great. You like to garden and do any other activities under the sun?
Yeah, sunbathing, I like it. Yeah,
You like
so
to sunbathe as well?
nice. So we actually go to Europe for
Okay. Oh,
specifically.
that's amazing. That's amazing. Oh, what do you do for a living at the moment? Are you a gardener by occupation?
I, I am. I was working, but now I just skipped it. But I'm doing it at home now for
Okay. You
myself.
mentioned you like to travel. Look, I have to ask a few more questions about your general health. And I'm sorry to ask you this. One of the questions I have to ask is, have you ever been diagnosed with having any type of skin cancer in the past?
No, doctor, not at all. No,
And
never.
has anyone in your family ever been diagnosed with having any type of skin cancer in the past?
No, I don't know.
Okay, okay. All right. And do you have any medical conditions?
No, doctor.
Okay. Are you on any medication?
Um, I- oh, sorry. Am I on the medication? Sorry, at this. Am I all right? So sorry. Doctor, actually, I just forgot to mention that I'm taking methotrexate.
Okay, okay,
Yeah.
okay.
For rheumatoid arthritis. I don't know
For
why.
rheumatoid arthritis.
Yeah.
Okay, okay. All right. And how is the rheumatoid arthritis? Do you have any joint pains or anything like that?
Oh yeah, doctor. That's why I just kept gardening now.
Mm,
Yeah, it's really tough, you know.
okay.
Yeah.
That's not a problem. So you're on the medication, and the medication, are they not working well at the moment? You mentioned you're still in pain, or you're not in pain?
Um, Doctor, they are mentioned they are working, but I'm taking it for 5 years now. So
Okay.
yeah.
All right. Okay. We will. I'll definitely look into that as well. Um, just one more question. Has anyone in your family, sorry again to ask you this, has anyone in your family ever developed any form of skin cancer in the past?
No, doctor.
Okay. All right. I would like to examine you now, if you don't mind.
Oh yeah,
I'd like
that's
to check your blood pressure, your heart rate, how fast you're breathing, and your temperature. I'd also like to have a look at the lesion. Okay. And I can see that it is irregular in shape and it is a
2 minutes
bit
remaining.
brown and dark, and it's not the same color as your skin as well. So thank you so much for allowing me to examine you. Um, so Samantha, there's a few things that can cause a lesion to change. Like you described, you had it for 10 years. And a lot of the time when a lesion is there, there's no problem. But when it starts to change, and at your age, and with some of the risk factors that you've mentioned today, you mentioned that you've been exposed to the sun, you mentioned that you've got rheumatoid arthritis, and the medication you take can suppress the immune system sometimes as well. Okay.
okay.
So because of that, I just want to be on the safe side. I'd like to make an urgent referral um, to the cancer service.
Oh, it could be cancer, doctor.
I suspect that you could have
Oh
a
my God.
type of skin cancer known as melanoma. It's not for sure once again, but it is the same sort of pattern when it starts to change in symptoms and it looks like that. We have to make sure it's not. Okay. All right. Is it all right if I refer you today? You can,
Yeah, doctor, yeah, definitely.
okay. You can definitely take someone with you to the appointment. Do you have anyone that can go with you to the appointment?
Oh, my husband will go that.
Okay, that's great because it can be a bit stressful as well. Do you have any other concerns or worries at the moment?
Oh no, doctor, I don't know. I haven't heard about melanoma.
Okay, look, even if it turns out to be that, there is effective treatment available. Okay, there are biological treatments that really improve everything, and we can, take measures. They just need to take a sample, a biopsy, see what's going on in there, and treatment is available if it's there, and if it's not there, we're all happy. Yeah.
All right, okay,
All
okay.
right, that's great. I'll give you a leaflet as well so that you're not left without information. Please, if you miss your appointment or you don't get your appointment,
Move to the next station.
I saw. I don't know why I forgot that. I'm not having a
so
good day.
yeah. How
Uh,
do we differentiate SCC and BCC? So, Dr. Swarna, that's a good question.
um,
I'll talk about that in a second. So I hope that was helpful in terms of having a look at how it goes. I don't know if you guys noticed, but each of my simulation is slightly different from the other.
yeah, it is, Dr. Radwan. Just one thing because she
Yes,
go.
please.
I don't know. I'm just having.
Feedback time. I think I
Uh,
missed smoking in here this time.
yeah. So, just one thing she mentioned that she Googled it. Maybe at the end, you don't have time at the end, but you have to mention don't Google the things.
Don't Google things.
Yeah, don't Google
What do
them.
you mean? I feel like her Googling it actually made her come. So
In the scenario, yeah, there it helped, but
yeah.
sometimes just to mention, yeah,
Yeah, just like a warning, like, by the way, sometimes when we Google things, sometimes it's accurate, sometimes it can really just increase your anxieties and worries. So I just want you to always take everything you read online with a pinch of salt and use, the best advice, use reliable sources like the NHS website. Use reliable sources.
In that way.
NHS
Still, I
site,
think the reflection there could.
So the difference, yes, thank you so much. Any other feedback?
No, it was fine. It was perfect, Dr. Radwan.
All right, that's good to hear. So somebody was asking, how do we differentiate Mr. BCC from Mr. SCC? So SCCs tend to be symptomatic. So they tend to bleed easily on touch. They tend to be non-healing ulcers, okay? And they tend to have, yellowing, discoloration, and things like that. Very friable in nature as well. For BCCs, they usually have, pearly edges, obviously, something like what you can see here. Let me just, So this BCC, I know that, looking at it alone is not safe. You have to ask for symptoms, okay? If there's no symptoms and a lesion looks like BCC, then you can say it's BCC as a suspicion, but it'll always have to be confirmed by a dermatologist as well, because they need to take a sample and actually look at the morphology or the epithelium or whatever of the lesion. I need you guys to know that if someone has any risk factors, such as itching, bleeding, a change, okay, and if there's positive smoking, family history, and these things, you have to have a higher degree of suspicion. So in my opinion, definitely, even if it's a BCC, but someone says it's bleeding, it's ulcered, you can say, look, it looks like a basal cell cancer, but it could also be another type of cancer. I suspect that the cause is a skin cancer. Because of these factors, I'm concerned. We want to be on the safe side. They would like to see a doctor explain the things properly to patients, informing them about what they're worried about and being safe. Okay, so you never lose for being safe. You don't ever lose when you're being safe. So hopefully we keep doing simulations. We're going to take a quick break, I think. 10 minutes. It's 10:10 a.m. It's 10:10. Okay, 10:20 UK time. We come back. Okay, so have some water, relax a little bit, guys. Thank you for joining. Will it be okay if we say skin cancer? It's good to say the type of skin cancer you suspect. Okay, and generally, the pattern will be very obvious. So one more time, I'll run through the different lesions and how they look like with you, and then you'll be able to recognize them easily as well. And based on that and the history, you can make a good suspicion. So we always suspect a type, and we're going to go through that. Rashes are also coming up next. More simulations are also coming up next. See you soon, guys. We are back at it again. So I was just talking about how to recognize SCCs and BCCs and things like that. I want you guys to recognize red flags, okay? If you have a skin lesion in someone who is older aged, okay, or has a comorbidity, what I need you guys to do is have a high degree of suspicion between SCC and BCC. You should know that BCCs are very slow growing and they tend to be symptomless. Okay, so you just need to literally look at the scenarios here that I've showed you to understand that. This is someone who has comorbidity. So one more time, run through these. So this is a 65-year-old, okay, presented with a skin lesion, So it's a BCC, okay? There are no other symptoms, okay? The wife noticed it. He had a similar lesion. The GP did cryotherapy, okay? No symptoms and risk factors of sun exposure. Because it's asymptomatic, you should know BCCs are slow growing, okay? They're not a troublesome type of cancer. Actually, we tend to make routine referrals. The only time we make an urgent suspected cancer 2-week pathway referral is when it's on the face. And sometimes if somebody's scratched it or done stuff to it, it can become a little painful. But usually there's no ulceration, there's no bleeding, there's no discharge, there's no itching, okay? And it is usually also very clear pearly edges. You see that there? Pearly edges. It's very pearly edges. and then it's got, you know, an indurated center. So the center is a bit indurated, but even when you look at the center, it is not malformed. It's just indurated, and the edges are pearly right there, and it's swelling outwards. So very straightforward. The description, the only thing is sun exposure. There's generally no symptoms. So that's how you can know, okay? And remember, guys, in these scenarios, it's not necessarily about saying, oh, it's a BCC, oh, it's an SCC. It's about saying, hey, you've got 1, 2, 3 risk factors. If there's no concerning change, then we can confidently say routine. If it's on the face, obviously it's still a 2-week cancer pathway referral, okay? And the next one, for the SCCs, I've given you different types of scenarios, as you can see. The wife, again, noticed it, but this time, it's been there for 1 month. Yeah? 1 month. Look at that. These are faster growing. Squamous cell cancers are faster growing than BCCs. So they're not around for a long time. They're there 1 month. Usually, that 1 month mark is how they test you. And they'll tell you it's reddish. Okay? And there's yellowish discharge in this one, but usually it bleeds easily as well. It bleeds easily, and there will be some risk factors. Okay, I worked in China, Australia. What does that mean? China and Australia are very, very sunny places. Okay, China and Australia are very sunny places. You need to ask directly, when you were in China and Australia, what did you do? And obviously, were you exposed to the sun a lot? The answer is yes. Okay, and you've got the history. Now you need to deliver the suspected diagnosis. Okay, so remember that for me. 4 weeks or more of an ulcer or a lesion, okay, that could be bleeding, that could have discharge, that could be a bit red. This tends to be something that tells you it's SCC. Another one that tells you it's SCC. This is on the elbow this time. How do I know it's likely to be a squamous cell cancer? Because it's not going to look like a melanoma, that's for sure. Right? Melanomas are dark, pigmented, and we'll do that next. But the SCC is increasing in size, again, itching, bleeding, okay, and sunbathing. Duration, again, 2 months. And they tend to think it's an infection because the way it bleeds and itches tells you, hey, I've got an infection. But guess what? This ulcer has not healed in 2 months. The ulcer has not healed in 2 months. You can take DDs. You can ask about fever, weakness, weight loss, any unwellness in general, any other lesions in the past, blah, blah, blah. But remember, your risk factors will be, again, some history. And the difference between BCC and SCC is duration. BCC slow growing, SCC 2 months, 1 month ago. It came 2 or 1 month ago. Okay, and obviously it is very symptomatic. It can bleed, etc. That's how you know. Next, we have for you to pay attention. Everything I've been saying, again, if they don't describe it as a lesion, descriptions can be an ulcer or a sore. They can describe it as an ulcer or a sore. Again, it doesn't heal within 4 weeks. Everything here you can read is what? Doesn't heal within 4 weeks. Is itchy, crusting, scabbing, bleeding more than 4 weeks. Yeah. The last scenario we saw was 2 months. Yeah. 2 months of itching and, you know, redness and things like that. Okay. The skin, when it gets broken, there's an ulcer. This ulcer doesn't heal within 4 weeks. It doesn't heal. Okay. And so these are the things that tell you it's an SCC over a BCC, especially when you have a look. Now, what tells you further, and this you should know, because when you're explaining the risk factors to the patient, it's part of the exam to explain some of the risks. Okay, when we're being patient-centered, it's also about. Sorry, how's the voice? Was it clear? Okay, so the sunbathing, the methotrexate, the immunosuppression, yeah, these are risk factors. Other risk factors include smoking. Yeah. So family history. When you take your PMAF-TOSA and you get the sun exposure and you get the past medical history and you get the medication and you ask about smoking, you now have risk factors that you can explain to the patient why you are worried. And this is the suspected cancer explanation for any kind of scenario. Mr. Johnson, there's a few things that can cause someone to lose weight, but I am concerned. I'm concerned that you've lost your appetite, okay? And you have also been smoking for a number of years, 20 years. And because smoking is a major risk factor, or Mr. Johnson, because you don't have any other symptoms other than blood in your urine, and you are 60 years old, and you mentioned you worked in the dye industry, okay? These are factors that increase the risk of someone having a type of cancer known as bladder cancer, right? Or known as lung cancer, mesothelioma, okay? Because you worked as a carpenter, okay? And you could be exposed to asbestos, and you also smoke. I suspect that the cause of your problems could be a cancer of so-and-so. So these are why we do the history. You must cite the risk factors. Anyway, extra knowledge, yes. Rheumatoid arthritis, methotrexate in this exam. For eye symptoms, scleritis. When you have rheumatoid arthritis on methotrexate and the person has ear pain and otitis externa, okay? Rheumatoid arthritis on methotrexate with a skin lesion is what we've been seeing today. Do not overload yourself with information. Don't try and be perfect. The key is you don't need to know everything about something, but you do need to know something about everything. Have a general idea about everything. You don't have to be a specialist expert. You need to recognize red flags. You need to recognize risks. You need to explain them, and you pass. Melanoma. What do we know about melanoma? Again, there's a change in size. Usually, there are diagnostic criteria, right? It's about the diameter. It's about the border. It's about the shape, okay? And so when you look at someone's lesion and they've explained to you it's growing in size and the margins are irregular and there's a sensation change, and on top of that, sometimes they have family history or risk factors like being in the sun, and it's a pigmented lesion, this is suspected melanoma. The only one that I need to warn you guys about is one we'll do later, seborrheic keratosis. Now, seborrheic keratosis we'll look at when we get to the scenario, because it's also, you know, black, but you'll see the difference, and I'll explain to you the difference as well. Melanomas are suspected to be cancer pathway. Explain the risks, okay? Sun exposure, and the way the lesion is symptomatic. Chemo, radio, surgery, other options, once confirmed, and reassure them that even if it turns out to be, there are treatments available that can significantly improve the symptoms. So now we have something simple, a lipoma or a mole. And usually this kind of scenario is about explaining the options. That's what it's about. So it's a different type of scenario you're going to see right now. It's more along explaining her options. And obviously, Dr. Nida, I want you to ask me, is the NHS trying to save money? Because you want it removed. You want to remove this lesion, okay? Let's call it a lipoma. So a lipoma, guys, is usually the same color as the skin. It is under the skin, and it's, you know, it's like it's a fat lump, okay? It's a fat lump. It's under the skin, no symptoms. Yeah. So my job is to take the history of lesion, ask the usual questions. The answers are going to be, it's the same color as the skin. The borders are regular. It doesn't have any symptoms. It's not getting bigger. It's been there for 10 years. And then there's going to be a reason I would like it to be removed, doctor, because I have a wedding and I really don't want to wear my wedding dress with that thing showing. It's horrible. I have to show my IPS, and I have to show how I say no. And I have to also explain what options there are and answer the question, what are my options? I don't want a scar. Removal, right? Okay. So I've written something in here just as guidance for later when you're looking at things. But I think, Dr. Nida, you can just, you know, you can simulate somebody who has a symptomless lipoma. Okay, so it's very much homogeneous on the shoulder. And I can do the same history as usual and start explaining the options. Okay, so One more thing, guys. If you practice every day, you will become cerebral in your approach and it will not cause you many problems. And with the right guidance of practice, you get to see how it's done as well. But definitely, you should be trying these every day yourself.
Begin. Enter the room.
Hello. Oh, you're muted.
Yeah.
To the next station.
Okay, let's start again. 3, 2, 1, go.
Begin. Enter the room.
Hello.
Hello, doctor.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can I just confirm your full name and age, please?
Yeah, it's Samantha Smith, and 24th of June, 1998.
Okay, and what can I call you today?
Samantha's fine.
Okay, nice to meet you, Samantha. How can I help?
Doctor, actually, I have this